Hi everyone, and welcome back to studying 101 genetic conditions for the ABGC board certification exam. My name is Nadia and I'm a 2025 genetic counseling graduate studying for the August boards exam.
Excellent.
And thought it might be fun to make some videos with tips and tricks that have helped me study, and hopefully they can help you too. I am using every gene as a guide for which 101 genetic conditions to study, as well as what information to know. I've started with the disease category of cancer genetics and have made 5 videos so far. The last one featured MEN1. So you guessed it, this video we're going to be talking about MEN2. MEN2 is another autosomal dominant genetic condition caused by mutations in the RET gene, which is a proto-oncogene and not a tumor suppressor gene like MEN1. There are 2 subtypes. We have MEN2A and MEN2B, and those letters will help you remember the different features. MEN2A is much more common than MEN2B, and I like to use that A to think of adrenal and adenoma. Adrenal for the pheochromocytoma risk, and adenoma for the parathyroid adenoma. For MEN2B, think of body shape, belly issues, and big mouth/lips. For body shape with MEN2B, we can see a marfanoid-like habitus, so a body that is typically taller or more lengthy. And for belly issues, we can see ganglioneuromatosis of the GI tract. Then for the big mouth and lips, that helps me think of the neuromas of the mucosal surfaces that we can see with MEN2B. And then for both subtypes, we see medullary thyroid cancer as well as that pheochromocytoma. Because medullary thyroid cancer can show up quite early in MEN2, these patients will sometimes be recommended a prophylactic thyroidectomy. So when I think of the RET gene with MEN2, I think of red flag, and that's why we can recommend that surgical decision. All right, everyone, that's all I'll be covering for MEN2 in this video, but please comment any other tips or tricks you have for studying for boards when it comes to MEN2. Make sure to subscribe, follow, like, and comment, and of course, save this video for your future studies. Thanks, bye!